Okay, everybody. Welcome to the monthly Georgia Healthy Farmer Mindset virtual meeting. I appreciate everybody being here today, and we're just so pleased to have with us today as our speaker Jennifer Dunn, who is one of our most vital and active GAWA colleagues. And Jennifer is currently serving as the Deputy Assistant Commissioner for the Georgia Department of Behavioral Health and Developmental Disabilities. She previously worked at University of Georgia as University of Georgia's Rural Health Agent for the Southwest District of UGA Extension. She earned her bachelor's and master's degrees in child and family development from the University of Georgia in 1996 and 2001, respectively. Jennifer is a licensed marriage and family therapist, a recipient of the Intensive Cognitive Behavioral Therapy for Schizophrenia certification at the Aaron T. Beck Institute for Cognitive Behavioral Therapy in Philadelphia, a trainer for mental health first aid and QBR, which I think all of you know is question, persuade, and refer, to assist with suicide prevention. Before beginning her position with UGA Extension, Jennifer worked for the Department of Behavioral Health and Developmental Disabilities for 16 years, where she served as the Regional Services Administrator for the 24 counties located in the southwestern portion of the state. In her current role, Jennifer is helping advance the vision and mission of the Department of Behavioral Health and Developmental Disabilities in the 89 counties of southern Georgia with a focus on rural communities. She is also an advisory board member of the Georgia Department of Community Health State Office of Rural Health and their Georgia Farm Worker Healthcare Program. She has a passion for all things rural and enjoys spending time with her husband, two sons, and 5 dogs. Almost got the math wrong there, Jennifer. Sorry about that. That's 2 sons and 5 dogs and one husband. Again, I cannot say enough about Jennifer. Probably no one in this conversation in Georgia about farm stress and mental health has done more direct to farmer producer contact than Jennifer. She's done a number of meetings, producer meetings, where she's talked about some of these really hard topics, but always is a great voice of hope and information about resources. And that's what we want to all be about. So thank you all for being here today. And with that, I'm going to turn it over to Jennifer. And so, Jennifer, thank you again for doing this for us.
No problem. Hey everybody. It's good to let's see, am I hear echo? Um, hopefully
Bubba.
so we're good, yeah. So
Yeah.
I'm really happy to be here. This I have a presentation. I'll start to share it in a minute, but uh I'm really, it's September, it's Recovery Month, it's Suicide Prevention Awareness Month. So I just really appreciate John having me on, and I see a couple of friends on the line. I see Noah and Erica and Eric and all kinds of other folks, Caitlin, um, Miss Glenda. So most of you guys could probably talk through the same, what I'm going to talk through. So this is a very casual conversation, meaning that, I don't want it to be one of those where I'm just talking at you. I'd rather, if you want to come off mute and join in and say something, please do so. John probably will have a lot to add, but I'm really hoping that you guys, if you have questions, you can use the chat or you can come off mute. I'm also hoping that normally I'm in my office. Today I'm actually working from my home office where said 5 dogs reside. And they are, one of the things we talk about in mental health first aid is attention seekers being attention needers. And so I reframe it and say my dogs are attention needers, because sometimes if I'm really focused on something with work, that's when they choose to say, "Hey mom, we really want your attention right now." So if I run off mute or I step out of the camera for a minute, it's because I'm opening a door and letting them move around a little bit. Since we're talking about something heavy like suicide prevention, And I mentioned my dogs, I want everybody to think about the things that bring them joy and things that you do that you like. Um, and having, spending time with my dogs is one of those, but also some other things like spending time with family. I feel like I am solar powered, so I feel happier when I get a lot of sunlight. So just because it's such a heavy topic, I just want to remind everybody to think through the things that kind of bring them joy. With that said, are y'all ready for me to dive into some of my slides just so we can kind of get the nuts and bolts? Okay, let's see if I can share this here.
You
Here we
should be
go.
able to, Jennifer.
Yep, it looks like it's going to work. So if I can just get up, maybe. Technology sometimes is a funny little thing. Is it sharing? Tell me when you see it.
Yes, it's saying you started.
Okay.
So it should be, there we go.
Okay. So I just wanted to talk a little bit about who DBHDD is. John did a good job of, reading my bio, which is boring. But our department is the agency that is tasked by our legislature to provide prevention and behavioral health, crisis response resources. We are what we call the state safety net provider for mental health, substance use treatment, and disability support. So what that means is individuals who have a mental health diagnosis, those who struggle with substance use disorder, and those that have developmental disabilities. We're tasked with helping them find access to care. One of the things we say all the time is, we should have services in the Cartersville, Georgia, that look the same as they do in Waycross or Dublin or Bainbridge. We shouldn't have to, if you're a citizen of our state, you shouldn't have to move to a certain part of the state to get the services that you need. They should be available to everyone. And so we work really hard to make sure we're offering those services all across our state. And as y'all know, Georgia is a very, very large state. John mentioned in my intro that I do like to talk about all things rural. And so I'm constantly in the road in South Georgia. My current coverage area is those 89 counties from Savannah to Columbus and down. I'm also in Atlanta a lot. And my colleague, Alan Morgan, he represents the north part of our state, which, the north part of our state has a lot of rural counties as well. So I wanted to talk today a little bit about suicide prevention in those rural areas and how that's looked over the past few years and kind of what I've been doing. We are an ag state. We're a very large ag state. As a matter of fact, the board that I sit on, the Georgia Farm Worker Board, that's for the migrant farm workers, the H-2A workers. We are now the second in the country for migrant farm workers, just behind Florida. So even more than Texas or California. And so we have a lot of people in our state that are in the ag community. They are giving us food, shelter, clothing. They're providing all those good necessities. But we've had some struggles in our ag community. And so they've affected not just those farmers, but all those other agencies and businesses that are connected to the farming community. And so some of the natural disasters that have that led me to this work, I started getting really focused on this particular work right after Hurricane Michael, or right around Hurricane Michael. It actually started the year before. I was getting calls from people that were asking questions about, how do we talk about suicide to farmers? There was a group at UGA that does the forecast session every year. And the year that Michael hit, in January of that year, they had a forecasting session, and they had, I don't know, anywhere from 300 to 500 farmers in the room. And the guy that was leading it called me the week after, and he said that somebody in the room, this is the forecast meeting where they forecast commodities, weather predictions, diseases. They just talk about, hey, what's in store for this next year? And this was in January of 2018. And a farmer raised his hand and said, well, what about the forecasting or the predictions for suicides? And the guy leading the session didn't know what to say. He didn't know how to comment on that. And he said, I think we need to start talking about this. And I said, absolutely, we can start talking about it. And then when it came time for me to come and meet with them, they said, yeah, we're not ready. And so sometimes with suicide prevention, that happens a lot where people think they're ready to talk about something. And then when you actually are ready to engage in that conversation, it gets a little scary. And so they back down. Fast forward until to October 10th of that year, and we had this event that sort of led us into this. And I got a call about a day and a half after Hurricane Michael, and he said, "Okay, we're ready now. We don't have a choice. We have to talk about this." And so we've had some other events in Georgia, like Adelia, Debbie, and Helene. Debbie, not as much, but Adelia and Helene really affected that Valdosta, Lake Park, and then Helene, went all the way up to Augusta. Who would have thought a hurricane would have gone as far north as that one did? And we also have, the avian influenza. As a matter of fact, there was a press release last week where there was a flock in, I think it was Henry County. So these kinds of things aren't going away. And then, when I talk with farmers, they always talk about, we just don't know we could have my dad's a farmer and I actually live on a farm myself. You can have the best, you can do everything right. You can be perfect and it doesn't matter. It could, because this is all unpredictable. And that's one of the things when I talk with farmers that makes things so stressful for them is all these things that are out of their control, like these weather events and like the crop production. So I'm going to stop there and see if anybody has anything to add or offer, because a lot of you do this work as well. I'd be happy for you to jump in. I'm going to do this a few times. I'm going to talk and then stop and give you time for reflection.
Jennifer, I know you've done so many of these meetings in the aftermath of this, and maybe this is something you're going to cover shortly. But what are some of the common themes that you're hearing from farmers when you're engaged with them in these producer meetings?
Yeah, so the producer meetings he's talking about, and I was trying to, by the way, guys, I could talk about this all day long. And so just giving me a little bit, like John and I have to do a presentation tomorrow, and I'm only going to get 15 minutes, and I don't know how in the world I'm going to do 15 minutes. And he and I presented last week or the week before last to some members of the Georgia General Assembly. And I had like 10 minutes or 12 minutes. And I was like, how in the world am I going to do this? But so these production meetings, so after Hurricane Michael, one of the things that we did is we decided to meet farmers where they're at and talk to them about stress. Because it was I have a saying that I adopted from way back in the day when in mental illness, we have the saying called nothing about us without us. And so you don't, create a treatment plan for somebody unless they're sitting at the table. Because if you go to a client and say, here's your treatment plan, you need to go to groups and you need to take your medicine and you need to do this or that, they're going to be like, well, who are you to tell me what I need to do? So I adopt that philosophy in pretty much everything I do, including with farmers. So we went to farmers and said, how can we talk to you about this stuff? And they said, don't talk about it. They didn't really want us to talk about it, but they said you can talk about stress. And so what's interesting is over the years, and we started this in 2019, I would go to the production meetings that are held by UGA Extension, by their agriculture agents. Every county in the state has at least one ag agent. And so these are places where these farmers get together and they show up to these meetings, and they're always held January through March because that's the best time for them, because it's not, for the most part, not planting or harvesting in those months, depending on what crop you produce. But I go to those meetings. They're there to learn about pesticides. They get pesticide credits so they can actually spray their crops and things like that. So I would go to those meetings and talk to them about stress. And the common themes, to answer your question, John, that come up is those unpredictable weather events that really stress them out. The something to do with money, whether it's commodity prices, input prices, something to do with labor prices. So these are things that come up all the time. And then, one of the things I ask them is, okay, so you have all these stresses. What do you do to relieve your stress? And there are things that they do to relieve their stress. So I'll pause and see if anybody wants to guess what are the things that they do to relieve their stress.
Typically alcohol use or other.
Yeah, that 100% of the time, Nicole, that is they talk about drinking. Some lately, I would say in the last 2 or 3 years, one of the things that comes up more and more is they say they work more. When they get stressed out, they just pour themselves back into working. Anybody want to guess another thing they do to relieve their stress? A couple of
Are
you
we
probably
looking for
know.
positive, negative, or either?
Either one, Eric.
Okay, because prayer and fishing, I think, are both high on the list.
So 100% of the time, prayer comes up, and 100% of the time, drinking comes up. And it's funny because they try to make light of it. Now, the hunting and fishing and things like that do come up, I try to reframe that in terms of it's almost like meditation. And I'm really I tell folks, I didn't really believe in meditation. I thought it was in mindfulness. Not that I didn't believe in it, but I was like, that's I don't know. It just it was a little too something for me until I tried it. And then I tried it and it worked. And so I was like, oh man, now I got to eat my words and tell people about meditation because it really does work. And so I talk a little bit about how, like, my sons who are grown, my husband, when you're out in the woods, if you're deer hunting, if you're turkey hunting, if you're fishing, that's a form of meditation, whether you realize it or not. And then I also talk a little bit about the Navy SEALs, the box breathing the Navy SEALs use, because if it's, good enough for Navy SEALs, hopefully it's good enough for some farmers. And then I get the farmers to start, telling each other what they do. Sometimes they'll say things like, I ride around on my motorcycle, or if it's a younger group of farmers, they might work out or something like that. So I, it's a good conversation starter. But thanks for asking that question, John. That first year when we had these production meetings, the group from Mercer, and I see a few people on from Mercer, they did this study. It's the Georgia Farmer Wellbeing Study. And they knew I was going to some of these meetings. And so they said, hey, can you hand out this QR code? And some farmers are fine with a QR code, some are not. I know at Sunbelt a couple of years ago, I was trying to get a survey done and I'd say, hey, scan this. And they were like, you're crazy. I'm not putting that in my phone. But I also handed out like paper copies for people. And the amazing thing about this study is this was recent data of, I don't know, close to 1,600 farmers. And so it was Georgia specific. And it was, pretty recent, which sometimes with data, you don't get that as much. But the thing about their stress and their coping mechanisms, the thing that jumped out at me was some of the suicide predictions. So, for example, you see there that at least once per month, 22% or 29% of farmers reported thinking about dying by suicide. And then 42% of all farmers thought about it at least once in the last year. And that's just too much. That's too much, right? 61% of first generation farmers thought about it in the past 12 months compared to about 10% of generational farmers. So these are just some scary stats to me. And so it was a call to action. Okay, so now that we have this information, what do we do with it? And then around the same time, the CDC, this was in December of 2023, put out their top high suicide rates, with farming, fishing, and forestry as the number 2. Construction was the number 1. So it's just one of those things that I was like, okay, it's not just in Georgia, right? But how do we do this? And so that led to having conversations with other states about how they are doing it.
I
I'm
would
sorry.
totally ask you out.
really pretty.
Oh, is somebody trying to ask a question or?
Yeah, folks, if you're not asking a question, please make sure you're on mute, please. Thanks.
Okay, good deal. Well, that's a good time to sort of stop us. Is anybody surprised that farming and ag is high on this list of, or is anybody surprised by the data that Dr. Stephanie Basie and Dr. Ann Montgomery? Anybody surprised by some of this?
I'm not
Some of you,
surprised that it's high. I am surprised that it's that high.
Me too.
yeah,
I'm surprised it's that high.
I think
yeah,
that it's not surprising, but I kind of can see it being that high just because typically it's a population that's like, I don't want to talk about my feelings. I don't want, they kind of like try to push a lot of things under the rug in a way.
yeah,
And
yeah.
so I'm shocked that there was as many people who responded in a way.
So it's funny that you say that because one of the things I've learned over the last few years, John mentioned last year, I probably stood in front of about 3,500 farmers face to face in their production meetings because I went to a bunch of production meetings. And what I have noticed in general from 2019, over the years when I go to these meetings is more farmers are willing to talk about it. And I think it's because many of them have been impacted themselves. They either know somebody. So like I said, I tried to, go into these meetings and talk about stress. The other thing I would do is bring in the local health department and we would do blood pressure checks. And so we would talk about blood pressure because that's a little bit more digestible and something, hey, who has high blood pressure? That's easy to talk about. But because many of them have had some experience with either somebody in their family or somebody that they know, I've noticed over the years, people are more willing to engage in this conversation and more willing to talk about it. So I'm, I know. So one of the ag agents that I know every year when I go to his meeting, and he's got a pretty big group. When I say big, probably 80 to 90 farmers attend in that particular county every year. And he's always like, Miss Jennifer, I don't know about this year. I just don't know if we want to talk about it again. And then this last year when I was there were like, after the meeting was over, there were like 15 farmers lined up to talk to me. And I looked at him and I said, they're ready to talk about it, but you might not be ready to talk about it. And that's fair, but my philosophy is if it helps one person, even 1 out of 90, I mean, isn't that worth it to me? That's how I think about it. Okay, so do y'all know about 988? I think 98 yesterday was 988 day. So I always ask how many people know about 988. So let me ask it this way: does anybody not know about 988? And don't be shy because I ask this in every meeting, and there's always somebody that's like, I didn't know about that. So, like, I was in Taylor County week before last, and there was about, I don't know, 70 people in the room, and some of them said, I know about GCAL, but I don't know about 988. They're the same thing. So if you call 988 in Georgia, you're getting the Georgia, GCAL stands for Georgia Access and Crisis Line. We've had this line for a number of years. But I just wanted to show you a little 988 data. I want to tell you about it. It's the 3-digit lifeline. The calls are answered in 15 seconds or less. Year to date, we've had over 200,000 calls through calls, text, and chat, because you can also text 988 as well, which is helpful for people who are deaf or hard of hearing, or teenagers who don't, or young people who might not want to talk to somebody. I always joked about my two boys when they were, I mean, they're 20, almost 24 and 21. If they're in the house with me, they'd rather text me from upstairs to say, what's for dinner, than walk downstairs and say, what's for dinner? And so we really, are happy that we have the text feature. We did have a surge in an outreach that corresponded to the increased call volume in 2023. And then rural Georgians are reaching out more than anybody else. And because of that, we did a campaign where we had some images of farmers with some of our messaging for 988. And if anybody, needs any, we have little cards with farmers on them. We have all kinds of stuff and, like brochures that have a message from my boss, Commissioner Kevin Tanner, who, if you don't know, he is a poultry farmer. He has over 96,000 birds at his house and up in Dawson County. So the commissioner for the Department of Behavioral Health is actually a farmer. So he is always a good person for me to run things by, when I'm going to talk to a group. I did pull up, this is hard to see, so I'm going to stop sharing and just show you real quickly. I'm going to share. You can go to 988 GA data and just see kind of it's 988ga.org, excuse me. And when you go there, there's the first thing it's going to do is pop up a little, I'm going to see if it'll share it right now. So tell me when you can see it. Are y'all saying yes? I'm sorry. When I'm sharing
Yes.
my screen, I don't see. Okay, thank
Sorry.
you. Y'all move away when I need that verbal validation. So the first thing, if you go to the 988ga.org data page, it's going to ask if you're in a crisis, because a lot of people that are Googling, 988 in Georgia might be in a crisis. So I'm going to say, no, I'm not in a crisis. So I go down to the data page, and this is what it looks like. And this is available for anybody. And I'm going to go to locations, and it's going to spin for a minute. And what we're seeing here, and I hope these little ribbons are not in the way, but this data range is you can go up to the multiple values and click on. So I clicked on February to July, which is the last 6 months worth of data that we have. And as you can see, the counties that are popping up in the top 10, I mean, what do you guys notice about this? Anything
They're all
jump out at you?
pretty rural counties for the most part.
And a lot of
least-
them are in South Georgia.
Yeah. So this is, by the way, you can change the date range to any date range you want. I talked about the hurricanes and stuff. Sometimes I'll play with those months and look at like 3 months after Idalia or 3 months after Helene. We did not have this available when Michael hit, but you can see kind of a swath where it goes up to those counties. But this is always good information to have. Now, I live on the Thomas Grady line, and you can see Thomas is number one for the last 6 months. So do you think down in Thomasville, Georgia, we've just done an excellent job? We've just done a really good campaign on 988. I mean, is that why these folks are calling more frequently than, say, they are in Fulton or DeKalb?
I would say, there probably is maybe some impact by that, but for the most part, I think it's that area has just gotten hit so often, over and over and over. And then you add in the general stress that is pervasive in the ag community. And you've got a high percentage of the population there are involved in agricultural production and agribusiness.
Yeah, and when I first used to see this, it like part of me was like, my gosh, what's going on? But the more I had time to think about it, I was like, I'm so glad people are calling, because obviously if they're calling, they need help. And I'm so glad that we have this available, because then it made me think about, before we had 988, what were they doing and how were they reaching out and who were they talking to? So somebody on the call, give me a county for me to look at real quick. It could be a county that's on this list of the top 20 counties. It could be a different county.
Well, I was curious about what to
Sure.
make of Clark County, for example. There's almost no agriculture in it, and it's in the top 10. What are we thinking about some of those counties?
Yeah, I think again, like Clark County may not be a big ag county, but there's a lot of students there, right? And we've done a big campaign with universities and letting people know that this is available. Um, I mean, that's just my first kind of gut response to that.
Well, I think my point was is well, I mean, I'll add to that. That wasn't my point originally, but that it actually is it reaches a broad group of people, not only rural but more urban areas and more metro areas. So yeah, thanks for clarifying that.
Yeah, I think you're right. I think it's not just, the rural counties. I appreciate you bringing that up. Anybody else want to say another county that you want to ask about or highlight?
Macon County.
All right. Macon's down here. There it is. So 106. Give me another one.
Someone in the chat suggested Lawrence County.
Oh, okay. Where's Lawrence? There we go. Seventh. Yep. Yep. Thank you. When I was in that meeting the other day, I was in Taylor County. So Taylor County wasn't very high, but so let's just look at the last month we have data for, which is, and we should be getting the August data any minute now, but let's just look at July. So if you look at July, it changes a little bit. Still some of those southern counties, right? But when I was in, where's Taylor? They moved up a little bit, but next to it, they had Talbot, and which was 10, so they had some. So even though I was at this event in Taylor County, some of the neighboring counties had some pretty high rates. So I just say all that to say, this data is available for anybody if you want to look at it. You can also do the demographics over here. It tells you, right now, it reset it back to those 6 months. So, some people are not wanting to disclose their age, but you can see 25 to 34 is a high group. You can see they also might not want to disclose their gender or their race, but these are some things you can look at the call breakdown, how those are going, like how many people so one of the biggest myths is if I call 988, they're going to send the sheriff's department out or they're going to send out the mobile crisis team. Actually, that's a lot of times that's not the case. Most of the time, the calls can be answered and directed, to a outpatient appointment. It doesn't require that they actually, have to be taken to a crisis center. You can see the calls requiring active resources. Active rescues. And then the speed to answer. So I just think this is a good, we have some researchers on the line that might be interested in that data. It's available, all the time, anywhere. While I'm pulling back up my presentation, other thoughts while I'm doing that real quick? Okay. So I think I, kind of made the point. We've got a lot of our counties that are very rural. The suicide death rate in rural Georgia increased by 7% from 2017 to 2022. And the death rates in rural areas of Georgia are 26% higher than in suburban and urban areas. So, and this is just another slide that had that data that I just showed you for those 6 months. The other thing that I wanted to talk about briefly, and I think, John, time check, you wanted me to go until about what, 12:40, 12:45?
Yeah, exactly, Jennifer. If we can wind up by 11:45, that'll give folks a chance for further discussion and sharing information about things they have going on. I think we're on a dog break right now. There you go. Dog mom break.
Yes, that's right. Yep, you may hear some barking. Okay. So I wanted to talk a little bit about kids. Because a lot of people, don't know, and I've got a lot of information that I can share. So anybody that wants this presentation is happy. I'm happy to share it with you. You can email me. But we have an APEX program that's in our school system. APEX is a program that where we're working in schools to try to help prevent, crisis. It's for anybody in the school system, but I did want to show you where the schools were. And here we go. I think I missed this slide. Okay. So my first slide was how are we serving youth and children? We've got a couple of projects right now, but this is where our APEX schools are. This is a map. And you can see there are some white areas where we do not have programs. Now, that could be for a couple of reasons. There was a county that I worked with recently where we offered it to the school system, but the administration was not interested in that. But I always like to bring kids into the conversation because to me, kids are barometers of the household. I just wanted you to kind of see a little bit about the schools, where they are, if you're in, if you want to look at a particular county. But this is a good way for kids to self-refer. We've had some events in schools like we had in Winder last year. Actually, we just had the 1 year anniversary of that, and our team went out and did all kinds of fun projects at the school. It was a really nice day for the students. They planted a lot of memory gardens and all kinds of interesting things like that. So we are having some barriers because what happens is a lot of these counselors and people that we hire that are in the schools get recruited by the school system, and then they leave us and go to work for that school, which is not surprising because of our workforce issues. So we did have quite a bit of turnover in the 2023-2024 year. So we're looking this year to hopefully get our folks up to market value so that they choose to stay with us instead of going to work for the school system. At the end of the day, they talk a little bit about some reasons for higher workload, but inadequate salary was a big part of that. And then the availability to work remote opportunities was another one, but it wasn't as high as the other two. So looking forward in terms of what we're doing some telehealth expansion funding. We got $1 million appropriated in FY25 to support some of the telehealth stuff we're doing with these programs in the schools. We are providing direct grants to schools to facilitate some of this and working with our RESAs. We've done several presentations recently to local RESAs, which is the Regional Education Service Agencies. And a lot of times I was at one last month. I'll be talking to principals and superintendents and, some schools, it's amazing. We think we do a good job of getting the word out, and then we find out we really haven't done that as well as we thought we did, because I'm always surprised at the people that don't know what we have. But also just how we are looking forward in the future. We've got this echo training we're doing where we're working with pediatric primary care providers in Georgia to identify and address behavioral health disorders. And we are focusing on some rural and underserved areas. We do have what we call clubhouses. And if you've never been to one of our clubhouses, please let me know. And I'd love to set up a tour for you. These are amazing, amazing programs for young people where they do all kinds of activities. And somebody asked me one time, is it like a boys and girls club? And it's not. It's therapeutic in nature, but some of the things that we offer in the clubhouses are things that traditionally you might not be able to bill for. So I know there's one near me, there's one in Thomasville, but there's also one in Albany. The one in Albany is really neat. They've got a sound studio where kids can go in and record tracks of, themselves singing, or they partner with the local technical school, and the technical college comes in with their culinary students and they teach them, how to cook They grow like, tomatoes and peppers and things in their little garden. And then the culinary students come in and they do all these partnerships. They partner with police departments. And they do donut runs for the cops, which is fun because they'll get, the police officers, they'll take them donuts, they'll do these little events. So these the clubhouses, whether they're what we call a mental health clubhouse or a recovery support clubhouse, they're amazing. And then finally, the annual Teen Suicide Prevention Summit. I think this year was our 5th year, and it was this past Saturday, up in Gwinnett. And so if you haven't been, we do that once a year, and our suicide prevention team gets up and coming artists. So last year it was in Valdosta. It's moved all around the state. And I remember the planning committee told me who was the up and coming artist. They partner with iHeartRadio, and it wasn't anybody I knew. But when I talked to some young people I know, they were like, "Oh my gosh, I can't believe you're going to get to go to that thing!" And I said, "Well, come with me." And so we took some kids with us. I wasn't able to go this past Saturday, but it was a big hit. And so if you're interested in that, let me know, and I'll make sure you get on the list to receive the information next year. And then because of some things going on with young people and school stuff, the Behavioral Health Reform and Innovation Commission has developed a work group to address school-based mental health stuff, with part of that being a safe school plan enhancement, and that's listed there. Behavioral health training clearinghouse, we're working on that. A behavioral threat assessment and management. Expansion of our APEX program, which I already discussed, and in-house tier 2 skill classes. That's for early intervention to prevent, those high acuity cases. So we're doing some pilot programs, as you can see, but this is the Behavioral Health and Reform Innovation Commission. They have several different subgroups, and this is just one of them. And I just thought I'd mention some of that. I'm going to change gears and just talk real quickly about the Farm Stress Summit. So many of you on this call have been to one of our Farm Stress Summits. We started in 2022 in Tifton. 2023 was in Macon. 24 was in Pickens County, which was Jasper, Georgia. And then 25 was in Statesboro. So I've got at the top the 2026. John's been working on with a group, and it will be held at Fort Valley State. So that will be March the 12th. I'm pretty sure we're set on that date, John. I'll defer to you to see if there's been any changes.
Yeah, that seems to be the date, unless something comes up that we're not anticipating. But yeah, that's the available date, and looks like that's when we'll do it.
So hold that date, but more information to come if you're on John's listserv. I know you'll be getting that. If you have feedback because we're in the planning, the throes of planning now. So if you have feedback on who you think would be a good speaker, who you think what would be a good topic for us to cover, these are really good events where we get our mental health and our ag folks together and talk about how to address this stuff. It's a one-day event. This year, when we were in Statesboro, we had Dr. Connie Baptiste as our keynote speaker. We had Commissioner Tyler Harper, Commissioner Kevin Tanner. We had all kinds of great folks. Dean Sumner from Mercer. It was really, really nice. We get to talk about research. We get to talk about best practices. It's just pretty amazing. So I'm real proud of the work we've done with that. And then I always try to end my presentations with, if you don't know who DBHDD is, this is where we are. You can scan our interactive map if you want to know who is my person in my area. And it's got our team members. We have our regional directors in each of those regions that are out there on the ground. So if you're having an event in your area and you want some DBHDD representation, you can do that. And then finally, I always end with our social media. I've got my email address there. You can email me, you can call me. If you go back to this map and you decide you want to reach out to me, my name's on that with my contact information, but I always end with that. So I'm going to stop for questions. I think I ended right at 12:45. I hope I didn't talk too fast.
Thank you, Jennifer. Great information as always. And I appreciate you making it so conversational today. So I hope folks will be happy to jump in. I do want to mention a couple of things before we go, but I'm going to open it up for discussion with Jennifer first, and then we've got some things that we want to highlight that are coming up here shortly, including the prescription for prevention conference next week. That's next Thursday, the 18th, at Mercer School of Medicine, and Glenda has put a registration information in for that. So, we'd love to see folks attend that. That's in partnership with CWC Alliance. And Glenda, do you want to say anything else about it at this point, or any information about any kind of deadline for registration?
There's no deadline, and it's always free. So anything we do is free. We hope you'll come out. It's for anybody interested, but it's geared mainly towards physicians, healthcare professionals, counselors, social workers. But advocates are more than welcome. And then we get to have Jeff Reedlove and the recovery bus will be there that evening for a program. So it'll be a fun day.
Thank you, Glenda. And I'm going to put the link for the schedule for the recovery bus as well in the chat. So, other questions for Jennifer before we open it up to the floor?
Jennifer, I did have a question actually about the 988 calling, just as we were talking about those factors that have influenced, patterns of use and that sort of thing. And I'm curious, I'm sure that there's ongoing marketing of 988, but have you ever looked at that map kind of around a real concerted effort and seen how that might be related to spikes in use, either in areas where it had not been marketed as aggressively or just generally across the state?
Yeah, we've done that what the comms team called like geofencing, where we see a county that we're trying to do a little bit of predictive behavior, and so we're like, okay, maybe we need to, get on social media and market 988 a little bit more in a certain area. I always laugh when they talk about doing billboards because, depending on where you are in certain parts of Georgia, you might not see a billboard. So but they do. I mean, but I'm always surprised because I'm driving all around the state, and every time I see a billboard I'm like, oh, look, and I take a picture and I send it to the comms team, and I'm like, oh my gosh, I love it. But yeah, I think that I can think of a county in South Georgia where we had two or three, high profile suicides, a police chief, a judge, people that were very well known in the community. And so whenever we have that kind of thing, we do some outreach to make sure people are aware that this is a resource that's available to them. I mean, it's just a call. We want people at the end of the day to know that hope is available. So a lot of our messaging has the word hope on it. But yeah, so we've done some targeted areas where we think there might be a spike. We're trying to do a little bit more of that predictive. Okay, if we're like, if we know an area might be hit by some sort of, obviously if a tornado hits, sure, that comes out of the blue, you don't know about it. But so I can think of a few years ago, we had a tornado hit Cook County and 988 was not available. And I fast forward and think, okay, if that happened now, what would we do? And we would do some of that work.
Absolutely. Thank you.
Yeah.
I'm gonna Noah, while we got you up on the wide screen here,
Yes,
we're
sir.
I'm going to give Noah an opportunity. Noah is working on his doctorate at UGA and has been a great advocate, friend, and colleague in this work. And he is doing a survey right now. And I'm going to as part of his doctorate, I'm going to let him talk about that a little bit because if we could help him connect to some of the folks that he needs to get to fill out this survey, that's good work we're doing because he's doing good work. Noah, take that away.
Well, thank you, Dr. McKelvey, and you're too kind. I appreciate you letting me speak to everybody here today, and I want to thank everybody on the call for taking the time out of their day to be here. I've been very fortunate to work with Dr. McElveen and Miss Grant and Jennifer for an extended period of time now through GAWA, and it's just been a wonderful experience as I've been working towards this degree. So I work with Dr. Christina Proctor in the College of Public Health at UGA on farmer health and well-being work, and within that, I have kind of specialized or focused on access to healthcare in the farming community. And so the focus of my dissertation is looking at different factors that influence patterns of healthcare use, right? So how maybe normative beliefs and subjective norms in the farming community, as well as perceptions of accessibility, influence intentions to seek out and engage with healthcare. My goal presently is to reach farmers living in the state of Georgia for them to fill out a very brief questionnaire. It's entirely anonymous and also done online. It's very easy to complete. And it asks about kind of farmers' perceptions of the quality of healthcare that they have access to, as well as things that might be motivating or, disincentivizing, I guess I should say, of seeking out healthcare. I am hoping to reach, again, producers predominantly living in the state of Georgia with this questionnaire, and I was hoping I could possibly share the link to that specific questionnaire if there's anybody on the call that's directly involved in ag that might be interested in responding, as well as sharing my contact information if there is anybody who might be willing to, follow up with me and talk a little bit more about that research. So I'll drop both of those there in the chat. And one thing to note is that this participation is incentivized here. So anybody who completes the questionnaire can enter into a raffle for a Walmart gift card that I'll be doing kind of at the conclusion of my data collection. I've got 10 $30 gift cards that would be raffled off to people who did respond to that questionnaire. So I'm going to drop both the direct link as well as my own contact information there. And if anybody wants to discuss in more detail, please feel free to reach out to me. I would be more than happy to do that. Thank you all.
Thank you, Noah. I really appreciate that. And I think you've already got one taker in the group there, and with Caitlin, and I think Nicole may be also volunteering to do that. I hope I'm not speaking out of turn, Nicole. And Keely, thank you so
Thank
much.
you all
So
so,
look at
so much.
that.
I
That's the
really
power of a
appreciate y'all.
network. Yeah, I appreciate that that too. And so I do want to mention real quick on behalf of Jennifer mentioned, Glenda mentioned Jeff Breedlove from the Georgia Council for Recovery in the bus tour. They are looking for folks. Jeff reached out to me Friday, and I've made some calls, but they are looking for some folks that might serve on the panel at several stops in Southwest Georgia. And let me, I'm going to bring that up real quick because I want to mention the
I'll drop the bus tour schedule in the chat so that if
yeah.
anybody wants to know where it's at. Okay.
Yeah, I did that.
Oh, you did already? Sorry.
Yeah.
Okay.
But go ahead and do it again. Your link
No,
might
that's
be
all right.
than mine. But Donaldsonville, Bainbridge, and Moultrie, he's specifically looking for a panelist in each of those three stops, which would be the 29th, 30th, and I believe that's 30th. Hold on, let me, I'm yeah, no, the 29th for Donaldsonville and Bainbridge, and the 26th actually for Moultrie. Those stops, he's looking for someone to share about their journey to recovery. So if you know of someone in those areas that might be willing to serve on that panel with Jeff and some other folks,
I'll be on the
obviously,
panel.
That's a great thing.
Yeah.
So, all right, are you already scheduled to be on the panel?
Yeah, I'm on those panels.
Okay.
Yeah. Yep.
Okay. All right. Very good. And so, but if you can reach out to me, or if you've got Jeff's contact information, or Jennifer, we'll make sure Jeff gets that information. So, if you know of someone that might be willing to share their experience to inspire others and help others, that would be great. So, just wanted to mention that. Okay. We got a few more minutes. Anybody else want to share anything that's coming up just briefly in your area and with your work that you might want to mention?
I wanted to share that Georgia is getting a chapter of Farmer Veteran Coalition. So we're hosting a stakeholder meeting on the 19th via Zoom at noon. So feel free to pass the word about that. We're also looking for people who are interested in serving on the board for the chapter. So for any of that information, I can drop the email to the for the chapter in the chat, and feel free to reach out to us about any questions on that.
Thank you, Nicole. Nicole is doing great work up in Northwest Georgia and is really been willing to help us. So, Nicole, if there's anything that any of us can do to support that, please let us know. Happy
Thank
to
you.
help.
Thank you.
All right. Anybody else want to mention anything that's coming up that you'd like this group to know about? Right. Well, again, and just want to remind everybody that the mission of GALA is to create networks of support and information and resources for our Georgia ag communities, our rural communities around the state. So if there's something I can do in your area, or we can connect to other folks that can help you in your area around the state, please reach out to me. You can reach us through our website at gafarmstress.org, or I'll drop my email in here real quick. But would love to connect with you all. And if we can help you in any way, please let us know. All right, with that, I'm going to thank Jennifer. Jennifer, you are awesome as always, and I just really, really hope that you are recognized and people understand what a just resource and gift you are to this kind of work. So thank you so much. All right, everyone. Oh, next month. We are going to, and that'll be during Sunbelt Ag Expo on that Tuesday, the 14th of October. We're going to feature a panel of Georgia farmers who are going to discuss their perspective and on sources of stress and levels of stress in the Georgia agricultural community, and also the reason why they think it's important to support this kind of work and to really bring to bear the resources and information that folks like you all on this call can bring. So we're looking forward to that. More information and a flyer coming out soon on that. Thank you so much. And everybody have a great week, and we'll look forward to seeing you next time. Bye-bye.